an option to make correct choices for themselves. To talk about this today, we have with us Dr. S. Jayaram Reddy. Dr. Reddy is a Deputy Commissioner at Telangana Vaidya Vidhan Parishad Department of Health, Medical and Family Welfare, Government of Telangana. Dr. Reddy, we welcome you, sir. We have Dr. Shanta Kumari. Dr. Shanta is a senior consultant, OB-GYNEC and laparoscopic surgeon at the Yashoda Hospitals, Hyderabad. She's also the president of FOXY. We also have with us Dr. Punura Malti. Dr. Malti is a gynecologist and a superintendent at the Modern Government Maternity Hospital. Joining us another, we have Dr. S.V. Kameshwari, along with Dr. Surya Prakash Vinjamuri. Dr. Kameshwari, she's a gynecologist and the principal investigator, Department of Science and Technology, Government of India. Along with that, we have Dr. Surya Prakash. They both are the founders of Life Health Reinforcement Group. Along with this, we have Dr. Vairagam Rajalingam. Dr. Rajalingam is the chairman at the Telangana State Medical Council. Last, we have Mr. Manoj Saxena. Mr. Saxena is the managing director, Bayer Zydus at the South Asia head. He's a South Asia head at the Bayer Pharma. I welcome all the panelists, and I would love everyone to participate for this conversation and create the awareness about this and how we can actually reduce the number of hysterectomies and even create an awareness amongst the women around India. I would like to start with Dr. Reddy. Dr. Reddy, when we see, what are some of the, if you could tell, what are some of the reasons that the number of young women are undergoing hysterectomies, especially in the rural areas?
Yeah, that's I can agree for that, because recently, previously, I worked in the rural area. There, what the problem is, most of the females, after the childbearing age, they come to a doctor with rural practitioners like RMPs. And RMPs also, they misguide them, go for an hysterectomy. So to avoid the complications of in future, carcinomas of cervix, or in future of the bleeding problems or fibroids like that only. But one thing is completely is wrong. Why I'm telling is this one. These are unindicated hysterectomies. They are not at all indicated. These are all indicated by the only the persons, those are accompanying the female patients. Even though they are not the patients also, it's a normal thing only. Even for normal thing also, they will misguide them to go for the hysterectomies. That is happening in rural areas. That should be prevented by what I feel is best is the awareness. And as you told us in Telangana, maybe high number of hysterectomies are happening in Telangana. To prevent that, anyway, our government has taken a very much good initiative to prevent the cesareans. We are doing the cesarean audit for all the delivery cases. Those who have done the cesareans, who are doing the cesarean audit. Even for the private hospitals also, our government is doing the audit for cesarean. Like that, this also should be happen. Hysterectomies also, unnecessary, unindicated hysterectomies should be avoided. That's most of the things is happening in the rural areas. Once after the childbearing is, even there is something, a misconception in the females. They think that once you go, get rid of this uterus, so our problem will be solved. But it's not correct. And anyway, our great gynecologists are there in front with us, so they can tell us how to avoid and how to, give awareness to the female patients.
Thank you so much, Dr. Reddy. Like you have said, misguiding the patients. That's a very interesting thing. A lot of women who are being taken to the hospitals, they are being misguided by maybe even the doctors and maybe even the medical practitioners over there. So that is one of the reason. Dr. Shanta, I want to come to you and ask, there is a lack of awareness and the knowledge amongst the women, I mean, especially in the women and in the rural areas also. So and they easily go under like a hysterectomy operation, and when it is not even necessary. So how do we ensure that the right medical knowledge is made available to them and they can make right choices as far as their health is concerned?
Yeah. Good afternoon, everyone. I bring greetings from Foxy and Fico. First of all, I'd like to reiterate the fact that as Foxians and obstetrician gynecologists, we believe in taking care of the women we serve. So I think first of all, please, I think we have to remove from our concept of thinking that gynecologists are responsible for the hysterectomies or something. Okay, we have to see how best we can deliver the best care to our women. Be it when we are discussing with Dr. Jairam Reddy just now has talked about the cesarean section. We understand, and globally we are facing this epidemic of cesarean section, which we are trying to see how best we can optimize without jeopardizing the life of the mother or the baby. At the same time, we have to always make it very clear to the public and to everyone that no surgery should be the first line of treatment for any problem. Unless absolutely needed, no woman should be actually just offered an hysterectomy. If you look at it, we have to see how, where, and when the hysterectomies are also happening. In fact, we find, as Dr. Jairam Reddy has mentioned, many of the places is RMPs, all these quacks, and their liaison between them and some of the surgeons and some of the doctors could also result and lack of knowledge among the public. See, they are uneducated, they don't have much knowledge, so they have some small problem. They think that when they're told, okay, you get this surgery done, your problem will be solved. So that also will lead to a false impression among these people that hysterectomy is a one-step answer to all the problems. In fact, sometimes doing the hysterectomy is not going to serve their problem. They may have some pain, they may have some issues. But for everything, hysterectomy is not an answer. Just because uterus is there and they have finished their childbearing, some of these fellows are taking advantage of the situation of the poor people, illiterate and all, and offering this as a solution. So as a gynecologist, we strongly believe that only indicated surgery should be done and offered to the patients, and wherever possible we should try to conserve the uterus. That is the mainstay. And what I would always have to look into how we have to do the screening. For example, for CA cervix, we definitely need to reduce the burden of CA cervix. So we have to emphasize the importance of screening for CA cervix. All these issues and education and trying to make awareness drives, I think, are the best ways to see how we can handle this issue. And wherever possible, the government and all of us are also trying hard to see that we will try to curb some antisocial elements also which are there, which could be also a possible reason for this burden of unwarranted surgeries. Thank you.
Thank you so much, Dr. Shanta. And you have highlighted a very important point that it is like we have to make clear to the people about the surgery, like it is not always required. And going forward, I want to ask come to Dr. Malti. I want to know your point of view also. Like, what is one of the reasons for the increasing numbers of hysterectomy, like in the rural India?
Yeah, thank you for the opportunity, because I mainly work in a public sector. So the phobia is mostly because of cancer. Thing is, they get married at a very, very young age. They finish their childbearing again at a young age. They finish their pubectomy also at a young age. So what is now left is whether to hold the uterus or remove the uterus. The only fear every woman has is cancer. So what my suggestion would be, as rightly said by Dr. Shanta, the screening. Another thing is, nowadays we have a very good vaccination. Thing is, it is not free of cost. The cancer prevention vaccination, nanovalent we have. Earlier we had Cervarix. Then we had quadrivalent. Gardasil. Now we had nanovalent, a very, very potent. Now everybody understand that vaccination is the first preventive step, but it is not available in the public sector. But wherever there is an opportunity and whoever can afford, maybe we'll have to tell that the vaccination would be the first thing. So that phobia of cancer cervix can be brought down to a level by taking vaccination, as Dr. Shanta rightly said, by screening. This screening method is robust in a public sector. We do it on an opportunistic basis. The third important thing which I would say is common indication, apart from the phobia of cancer cervix, the second important indication for a removal is pelvic inflammatory disease. Again, lot of awareness and availability of lot of contraceptive methods. The other benefit of a contraception is not only to prevent a pregnancy, but also to prevent cancers and infections. And there's surplus amount of contraception in the public sector. So when awareness about the vaccination, awareness about the screening, awareness on the availability of contraception for non-contraceptive benefits. The third biggest indication for a hysterectomy is abnormal uterine bleeding. So they get exhausted with the medical management. They develop side effects. Then they think because of the side effects, they'll have to go for a hysterectomy. Now, what is available now in the public sector is LNG Mirena. LNG Mirena is another one where they don't take it orally. They don't experience much of the side effects. So everybody has to, there should be an awareness, the multiple methods of reducing the bleeding. So everybody has to, that awareness has to be created, and it is be utilized also, that there is one good media which acts locally on the uterus, which can prevent a hysterectomy. So explore the choices. So awareness, there should be demand from the rural women, that because now everybody understand the benefits of a normal birth, and everybody understand the C-section has got a good number of complications. Today, Minister had come to our institute. He interacted with a lot of them, and they were telling so beautifully what is the benefit of a normal delivery. That means adequate amount of awareness has been created in the state, because the government is now giving a lot of education on that. In the same way, we'll have to succeed on this point. When the woman understands, then there'll be a demand from her that can you explore something instead of a hysterectomy? So that is my viewpoint. Thank you so much.
Yes, thank you so much, Dr. Malati. I would like to go to Dr. Surya Prakash. Talking about like you both have been working in this and about creating awareness in the rural India, and you might have seen the closer numbers of the women undergoing hysterectomy operations. So is there a difference that over the time people have changed? The women do understand that there is an issue, and have they raised this question, or is it the same that they are agreeing for this?
Yeah. So first of all, I'd like to thank you, and also the team that talked about the uterine removal part of it. Here, we like to say this. At the field level, the situation is quite different when it looks into the institutional situation. The first and foremost, in 2001, when we in Sadasipet, in Medak district, when we came across as clinicians when we are running our rural clinic, the women who were, because that particular institution didn't have a good HR policy, the number of days they work, they are being given money. Okay. So just to get a 31 days period as an earning thing, there was an organized crime that happened where the bus used to come every Saturday, pick up women, get operated on Sunday, Monday they used to return. So one single industry, more than when we passed on a receipt in 2001, and the story has begun in 2001, then we have sent it. They said all the 300 women, all under 30, uterus was removed. So it's basically, there it is a deep shock for us, because we were young, got married, we want to do something for the rural India. So we went there and we were working. Then it came out of blue for us. I mean, because we were not exposed to this sort of, because we were looking at that everything is green. When we went, we thought by being good doctors and we can enhancing access to healthcare, we can bring in change. But when we touched this issue, frankly, we didn't know what to do. I'm talking about 2001. And it's a long story, so we will just go to 2011. After 10 years of presenting and after being part of the DBT, where the objective 3 of our things being supported, we could present what happens with removal of organs at that young age. And the implication, the document is available online. You can actually, it's an open source. All our work is an open source. So where we showed the implications of removal of an organ. And so the infrastructure was weak and we don't have enough data, whether only uterus was removed or uterus along with the ovaries is being removed. That data was major because we were working with a very basic parameters. We are looking at the FSH. And so those details of scientific components, Kamish will talk about. Coming to 2018, where because we had a Telangana movement and then our state, Telugu states got divided. And then we were asked to stop the work. So we stopped the work. And 2017, after we coming out with another 500 cases, showing the implications of removal of organ, what happens on women's health. With that data, when we approached the government of Telangana government gave us Yadadri, one district. So between January to October, we actually, again, we went on a campaign mode and educated every single village, not losing one single day. And then the elections came, so we were asked to stop the work. And then the COVID came. And then the entire work got slowed down. So what we are looking at is, while the approach of campaign is the way, there are multiple strategies we need to play. While we can't just say about only the medical sector, the poverty is one of the major reasons. And another thing is, if you, even today, if you look at it, if a 200 rupees more money is given, a woman jumps into one auto to another auto to the neighboring village to get a daily wage support. So for her, this previous issue is basically comes in between her execution of her responsibility as a mother, and she feels, yes, I have this choice of removal an organ where I can come out of the monthly disturbance that she is going through. But the implication is much higher, and that because they look at only one thing: did I really come out of the situation at that particular moment of time? So here comes the role of many sectors, like the policies that we have, the wage structures, if you look at it, and the and unfortunately, market has entered into the communities. And then the trees have disappeared. They don't have, what do you call, privacy factor is zero. Where the women, when they come to us in the village, if my sari is getting wet, it is messy affair. What should I do? I have no choice but to go for this. So here, by the time we go to, suppose Wednesday we go to a village, and the next Wednesday we go, the same woman, the organ is being removed. I'm just saying, how much handholding we can do really is a major challenge that we are looking at. And the quality of life is pretty low. It is basically for those reasons which make a woman compelled. So here I like to come to a point saying that the way the obstetric aspect of is being taken care, the gynec care, we don't have such good infrastructure available at the field level. So it is essential that we enhance the quality of care with the trained manpower, and where we do not be, the inputs that needs to go in is much higher, where we need to look at the curriculum of the paramedics that are being trained. So the strategies are in. And the damage is done. If you look at it, it's totally 1 crore women in India, uterus is being removed. The number is 1 crore. 33 lakhs is in Telugu states alone. Okay, so we don't have to look at who's doing it and why it is happening. It's clear that as Madam Malti garu cheppinattu, the way she went about saying, it is access and the choice, and the manpower is less. Trained health manpower is a major challenge that we have, and to handhold them, to tell them that how to manage our own menstrual cycles aspect of it. What the support systems within the family are pretty weak. They don't give a 1 unit of blood if it is required. If a woman requires unit of blood during her, the man doesn't volunteer to give. There's an issue of males' participation is a major challenge. They look at it as a woman issue. It is necessary that we need to look at it as the entire family. If a woman is sick, the entire family collapses. So necessary that we need to understand this issue, and we need to do not just the campaign, we need to enhance infrastructure, we need to enhance qualified health manpower, we need to look at it. And then we have to see that the market the way it pushes itself should be closely observed. So these are the things I thought while I say it. Kameshri would definitely share her the scientific observations about the implications of organ removal on the health of women, where it is between a doctor, that I'm talking about a primary health center doctor giving basic inputs, switch to a gynecologist. And we can't just say gynecologists are removing it. It is the surgeons are also, they remove it, not just only the gynecologist. And it is most of the surgeons, they don't even look at the face of the woman they are operating upon. They don't know who is there on the table. And it is a fact that the push and pull factor, the more number of doctors in cities. So to make money on the Saturdays, this is what happens. And it is a fact that everybody knows about it. And it's not that 1 crore operations happened just like that. It happened in a very systematically, it has happened. And we need to have a ombudsman where we need to look at who's running the hospital, the qualification of the doctors who are running the hospital. There are so many things, it's not just putting a pointer on any one single individual. And people, once they become rich, they move into positions and they can silence many people. So this is a fact. So they come into the administrative sides. So it's the same issue that happens. So what I would request here is, it's good that people are thinking about it. They're doing since 21 years. We know exactly what happens. Even if you have the best of the packages, we know how people make sure that we don't move forward. So it is necessary that let's just take this wonderful opportunity, because now you have said that you're going to come forward. Is a campaign. Now I'm 57. When I started, I was 30, right? So and it is this, but the spirit is high. When you people called, we thought we should share, and the data is available. We are here to share unconditionally. We don't put any conditions. If you feel and that you are really serious about it and you like to work on a time-bound fashion, we are available. And I like to shift to my wife, Kameshwari, and she's a principal investigator. Our work is being documented. The government of India, as said, is one of the best projects that has been executed, and she will share further.
So please share the link, sir. I would like to go through the data.
It is available, and the Maltigaru, actually, it is available online. It is called Medical Ethics Unindicated in the hysterectomies in the state of Andhra Pradesh, 2008 to 2011. All our work is because it's a national shame. I tell you, it is 75 years of our independence. We Indians, we had the energy to remove organs which are not indicated. I bow my head whenever a woman comes to me and she says, "Ayya," in Telugu I'll tell you, later I'll translate it in English. "Ayya, nuvu mo cheskodantav. Vaalla cheskomantaru. Maaku problem ala undi. Em cheyamantaru ani adugutaru." You understand what she's saying? Say that you come to you say uterus should not be removed. And after you go, there are a set of guys who come, it has to be removed. Whom should we believe? We want to get out of the situation. We have to work. Women in Telangana, they work. They work. It's the men who are not working. The men at least work and understand women, not just for sex. They should look at women and as a pillar of the family. It is a national shame. I like to record in because we said it in open also. 1 crore. How no government can do anything now. No private sector can do anything now. And because the data says very clear, that if an organs are removed, the supports that we like to give from outside, we cannot, even the doctors, the medical sector doesn't have a knowledge, our knowledge about how ovary really works, complete knowledge is not existing. Still the researches are happening. When you don't know basic rule thumb, if you don't know, at least say that I don't know. Don't take a law into your hands by just because you know how to remove an organ. So this is basically Malti garu, it's emotional stuff అండి. ఎందుకంటే మేము చాలా చక్కటి డాక్టర్స్ ల ఫీల్డ్ లోకి వెళ్ళాం కానీ we bumped against this case and we are fighting this case since 21 years, and you understand what 21 years at the field means. So
I'll go through. Thank you.
Yes, thank you so much, Dr. Surya Prakash. And we would also like to hear from you, ma'am, Dr. Kameshwari, about like how like we spoke about the different things, like in how the rural India is like affecting. Is it like just the only rural part of the Telangana and the Andhra, or is it like the other places also? Like if you have come across even in the cities as well, like in the similar context, like.
Yeah, we can't divide rural and urban, because in Telangana they stay 3 months here and 4 months there, like that. So we should not divide rural, urban, government, private. Who is doing? Let's just remove all these things now first. Then what it implies, 1 crore surgeries. So what is the research available? What are the gaps? What we can't do after removal? That we should actually, why I'm saying this is in Andhra and Telangana, average age at tubectomy is 22 years. Okay, after 22, most of the women, because before that they're pregnant, Asha Worker will come to their house, they'll do TT, everything. So in rural, obstetric care is excellent. They do institutional deliveries because of KCR kit. All those is happening. After 22 or 23, actually she's into a real gynec need there. That need is not fulfilled in Andhra and Telangana. That is the main thing. So that gap is filled by RMPs. So we are, because many of them were working in city. I'm working in a city. So rural, we can't do everyday practice. We're not doing there. So that is one thing. So huge gynec gap. Gynec need, gynecologist, or we can do only 3 months training to treat a white discharge and to collect a pap smear. You need a gynecologist there. That is one thing. Huge gap. Government is not actually supporting them. They need, because most of them in Andhra and Telangana, almost 70 to 80% rural women are anemic. So in our trainings in Adadri, one woman commented, whenever I go to a government hospital, they give only black tablets. So she's not willing to take them, and she's her daily wage is 500. Instead that she'll spend 200 for IV saline. Actually in anemia, IV saline is contraindicated. She may die with cardiac failure because of overload. So, but their knowledge is very little. I can gain 300 by spending 200 for IV. I can attend to my daily wage. That is the thing. So that one thing. So their anemia and serious malnutrition is a very, very serious thing. So that is the second point. Third point is, after removal, because most of our rural women, they know calculations. Because of Mahila Samakhyas, groups and other things, they know interest rates and other things. So to support them and to have a deep interest in them, we designed a curriculum, Let It Flow curriculum, Let It Flow campaign. So instead of saying take iron tablets, take greens, So we calculated their menstrual losses. So for after delivery, you lose in a vaginal delivery, she'll lose 500 ml of blood. For a C-section, at least 1 liter blood. So every month she loses 30 to 80 ml of menstrual blood to calculate 16 milligrams of iron. So those calculations were done, and after 10 years of menstruation, because these are into 23 and 28. So average age at hysterectomy in Telangana is 27. So in US and other countries, 44. So please understand this. This 27 number is very, very serious number. Okay. So they are very vulnerable because they had 10 years of menstruation, 2-3 deliveries, 1 or more abortions, tubectomies. If it is a normal delivery, blood loss is different. For a cesarean, blood loss is different. So that much iron loss she has. So our women, only we are calculating hemoglobin. We're not calculating ferritin levels. We're not calculating the reserve. That iron reserve we are not calculating. So losing iron reserve is first phase of anemia. Then hemoglobin loss, hemoglobin number rest. That is a third stage. So we are calculating less hemoglobin and labeling as anemia is only third stage. Okay. That third stage, we have 80% of our women. So in losing reserve, maybe 100% are anemic. So we're not treating them with iron and other things, and they are succumbed to more infections. And in our study says, in rural Telangana, most of men have more than 5 partners. So in our focus group discussion, they said they have more than 5 sexual partners other than wife. So their infection is running in between them, and they're not treating. And men won't come for STD treatments. And even the women have pain and heavy bleeding, PID. Most of our men won't take complete course of antibiotic. So that infection will be continuing. That's the STD, human papilloma virus, and cancer cervix is also STD. So we should understand this. These are the social issues related to this. And again, another thing I stressed on average age at hysterectomy at 27 is a very serious one very serious thing, because most of women's bone will be building till 33, 34 years. Bone building is dependent on estrogen. So peak bone mass will be attained in their late 30s or early 40s. That is in 25 to 35 age group. But these women are losing their ovaries and uterus at the age of 27, will have a huge impact on her bone. Okay, that's one important thing. This bone loss cannot be compensated by giving medication, because they'll be having low peak bone mass, and every year they'll lose 5% of bone in case of early menopause. So she'll be having early menopause, early bone loss. By the time she reaches 60, she'll have a serious osteoporosis. And whatever medication will give for osteoporosis, they'll falsely build the bone, because that microarchitecture can't be replenished. So we'll build the bone, but that fine structure won't, honeycomb structure won't be having. So that quality of bone, because whatever bone markers we are doing with DEXA and other things, only can measure quantitative loss, not quality. Also, DEXA is designed for postmenopausal women, plus 65 women. They calculate bone loss comparing with best bone at 35, bone density at 35. So that is T-score, all these scores we can say. Okay, Z score and other things. But now these women are only at 27. How can we calculate their bone? How can we calculate their bone loss? These are the serious issues. Whenever you give medication, if you supplement estrogen also, estrogen have many issues. So you can quote all the studies done in US and other things. when you supplement estrogen for a hysterectomized woman, she'll be having more deaths because of thromboembolism. So we are removing ovary or sometimes retaining ovary, but after hysterectomy, how many years ovary works, we don't know. And another thing to actually
Dr. Kameshwari,
do it can Dr. Scan it. I'll within 2 minutes I'll close.
I would like to stop and go to the other panelist.
Okay. 2 minutes I'll close. Within
Yes.
2 minutes I'll close.
I'll come back to you, doctor.
Okay.
As you mentioned about the various the different factors, there's a huge gap, and people are not being treated exactly like in terms of the anemia. They don't talk about the anemia. Instead, they go for the other options of operations. And then you also mentioned about the other things the various factors you mentioned, both like Dr. Surya also mentioned about the various statistics. Mr. Saxena, I want to come to you and ask, we spoke about the different aspects, like understanding the entire rural India of Telangana and how the hysterectomy operations have been happening and the stats. So how can we create a public health initiative and create a mass awareness, and maybe through various initiatives, and also bring in experts also to talk about this issue with the use of the mass media and social media to amplify our reach?
Yeah, no, thank you for having me. And look, Bayer has been working in the women's healthcare field as a innovative company since last 9 decades. Yeah, and it's also our responsibility to see what role Bayer can play to what is being discussed. I think Dr. Surya Prakash, Dr. Malati, as Dr. Kameshwari has narrated the entire spectrum of what's going on. Believe it or not, 21 years back, ING Mirena, which Dr. Malati was mentioning, was approved in India for HMB. Yeah, it's 21 years since the time we have been trying to work through to make sure that women in India have option. This is globally available for last 30 years. And if you look at from a cost per day, it is less than 3 rupees a day. At less than 3 rupees a day, a heavy menstruation patient can get the most innovative management of HMB, which can also have not just reduction in hysterectomy, but also manage anemia, which is very, very prevalent in India. And in that, I think one of the learnings over a period of time, and for last 2.5, 3 years, we are working very closely on this campaign, which is Preserve the Uterus. What we are trying to do in this Preserve the Uterus, and I know we have only 15 minutes, and I would like to hear more from Dr. Surya Prakash, Dr. Malati, because they are the experts. They know what's happening on the ground. But essentially, as a player in the healthcare, and also the impact which we have seen where women have taken Mirena, and we have heard those lovely, beautiful stories from doctors who are avid prescribers, and I think Dr. Malti was also saying around about some patients who have benefited. What we are trying to do is essentially create a mass awareness. Now, if you look at what does it require, it requires forums like today. If we don't do this, then we don't hear the stories and the passionate discussion which Dr. Kameshwari was just having along with Dr. Surya Prakash over the last 30 years of their work, but also many other people and partners in this. So bringing them together, providing communication to women on the ground, but also to the society by and large, so that we prepare channels of communications in simple, lucid manner where they understand that they have options. It's not just that they have to take the hysterectomy, but also they can question, they can go to a website, they have chatbot, they have information in Telugu, but also in other languages. So essentially they can communicate. But also we are also looking at how do we upscale the gynecologists as a community. So under the Preserve the Uterus, we have signed a MOU with Foxy Association, and this year we are actually doing scientific programs with 5,000 gynecologists. Yeah, so essentially, so that everybody understands that there is an option. Yeah, while we also understand there are challenges both in urban and rural setting. Not every solution could be found like a switch, but over a period of time, the idea is that the women in India feels empowered, is understanding what she's going through. She has better information tools in language which she understands. She has the right partners, and the healthcare environment, the infrastructure is prepared well. And I think that partnership is the formula for that. So whether it's IHW, whether it is Foxy, with also partners probably like HRG, and many other individuals who are passionate in this field to give a better respectable life for women in India. And I think that for that reason, this is what we are trying to do under the Preserve the Uterus. And I genuinely feel, and we have seen that across the board, issues like whether it's and we are doing it in critical states. And I think I wouldn't put the statistics because that was just relayed very well in terms of where does the Telangana is in terms of the number of hysterectomies, the average age of hysterectomies, and what could be done. So we are looking at 5-6 states to start with as a pilot to support, and also whatever is needed to be done, and which could be done from a pharmaceutical company in terms of who has domain expertise from a research perspective, to come up with a white paper, to have communication angles to the community. We are trying to do that. But I definitely feel for a topic like this, where there are significantly high number of hysterectomies happening, and when there is a modern way of managing it, we can all collaborate together, come together, and at least we will do better than what we are doing today. Yeah, and I think that's the intent here.
Thank you so much, Mr. Saxena, for that. And we do understand like how the Bayers is doing this initiative and creating awareness. And we hope that we create much like a better awareness and make make people understand about the situation. And the entire and come all of the experts also come together to actually tell people what is an issue over here. I want to come to Dr. Reddy. Dr. Reddy, we see that there are a lot of government initiatives around the women health, and like Dr. Malti earlier, she was telling about that there's a phobia about the cancer, and that's the reason a lot of people go for the cancer screening in the rural areas. So what is your take on the cancer screening, and as many rural women choose like a hysterectomy or like a fearing cancer? So is that like an issue here?
For the past 5 years, the medical department of Telangana, as public sector, has improved a lot, and they are increasing even the whatever the tests what the madam has told, as a pap smear and all the tests also. And most of our hospitals also they've been equipped with recently with the medical colleges are coming, new medical colleges where our hospitals are equipped with even hysteroscopy is there and colposcopy is there, and with other methods also they are controlling this screening procedure. They are doing it. And one more thing also, as madam what sir has told, Surabhika sir has told, that Telangana is happening, it's a hysterectomy is happening in more of the numbers. Yes, I agree. But previously it is happening. But right now I can say, because I deal with even the statistics also of Telangana, where I can see the public facilities, the number of hysterectomies are as compared to the what he told, I don't know. But as compared to the statistics number, very less. But in private sectors, they are they're doing a high number of cases. That is happening because of the non-professional persons. They are running in a nursing homes or some other hospitals. They are taking the help of either a general surgeon or a gynecologist or the person who can perform the hysterectomies with their help, and they are taking an advantage of a woman come to a hospital doctor in a confused state. They are taking advantage and they are doing it to prevent that. What the government has already taken the steps regarding the cesarean section, and at the same time, our government will take the steps regarding the fixing the accountability on the doctors in performing the hysterectomies. That will take a step from the government side.
Thank you, Dr. Reddy. I would also want to ask Dr. Rajalingam about the same, like how, if you could elaborate on that, the availability of cancer screening labs and the status of like all the related infrastructure. Dr. Rajalingam. Dr. Rajam, can you hear me? I think Dr. Rajalingam is not here. I would like to go to next, Dr. Malti. Like as you were also mentioning about the one of the issue that the cancer is because of the cancer phobia. A lot of women go and do their screening. So, how would you like see like the availability of the screening process, the labs available, and like how the related infrastructure? And can this be one of the reason that because it is easily available, people go, people are not much aware, and the entire procedure they can easily, because there is no counseling, so all these procedures are part of it. On how is it like?
Yeah, a good question. See, pap smear is not, it is an expert dependent. We need a pathologist, we need a lab, we need a proper collection of the sample. So every center, to my knowledge, is not provided with this, except for a DH, district level hospital, or a teaching level medical college hospital, which is facilitated with a lab and a pathologist. So wherever this is not there, the state of Tamil Nadu had trained their ANMs, the field workers, to see and treat, where they will just apply some amount of acetic acid or Lugol's iodine, and then they see white area, dark, not dark, bright white area, or instead of brown, a yellow area, that is an indicator there is some underlying problem in the cervix. So by just applying a liquid onto the cervix, they can pick up and then triage and then refer to the needy cases to a center where a pap smear is available. That is very, very robust in the state of Tamil Nadu. So I strongly feel if this can be started, initiated, then the screening can be strengthened. That is one thing. And the second thing, to create an awareness, I feel the government has to support by giving IEC material and then some message, because so many women will be waiting in the waiting area, so many people will be sitting there, so they can just listen and understand if the video is playing around. So that kind of technology, if we can have, I think partially we can curb this problem. That's my feeling. Yeah, thank you.
Thank you, Dr. Malti. Just to like add on, I would like to come to Dr. Kameshwari. Dr. Kameshwari, when we talk about the screening process, so can a regular cervical cancer screening and other related ailments also reduce the incidence of hysterectomy?
Yes.
Do you think
Yes.
it should be a problem?
100%, because we have to do 5 things at a time, because campaign is one thing, strengthening gynec care is second thing, third thing is cancer screening, and also combined with HPV, because pap smear screening is little tough for a pathologist, because we have pathologists, but cytopathologists work is strenuous, because they have to see 200 fields, then only they can comment on a slide. It takes more time and less pay for them. So that's why we need, as Malti Garu said, we can train ANMs and also we can train BSc and MSc students to screen a pap smear, and if it is a real serious one, pathologist can see. So these things are happening in Tata Institute of Fundamental Research in Mumbai. They are doing as a pilot. So they're training technicians, cytotechnicians. That is second part. And we can include HPV screen, because high risk cancer variants we can identify, and women with HPV positive, we can screen them regularly, and we are negative, we can screen them once in 5 years or once in 6 years. So then burden on pathologist and burden on ANM also won't be there, because 56% of our women are in reproductive age group. So screening should start by 30 and end in by 60. So women, 56% of reproductive age group women we need to screen. So these are the numbers. So there's a huge thing. Fourth one is saying them ill effects of, instead of good things uterus and ovary do is one thing. Propagating ill effects of hysterectomy, that's also needed. So you lose your bone, you lose your youth, young look also, skin also will be affected by estrogen. So all these things. And fifth one is we need to do in-depth research on these 1 crore women. What is happening to their bodies? Because uterus and ovaries act like indicator. So that menopausal period, irregular cycle and everything will give us hint. Hot flushes. So all this will give us hint. In the absence of uterus, we can't document irregular cycle. So that is menopausal uh, staging we can't do in the absence of uterus. So we need to go for in-depth investigations for that. That's a need. All 5 things should go hand in hand. Campaign won't be sufficient. All these 5 should happen.
Yes, thank you so much, Dr. Kameshwari. I would like to come to Dr. Reddy on like a similar line to understand that we spoke about the training the professionals, medical professionals, and teaching them also about the entire screening process as part of, as ma'am was telling, Dr. Kameshwari is telling about the HPV screening, about the cancer screen, all these things. So, like, how do you think like we can overcome the issue of awareness creation and the capacity building amongst the medical professionals and women as well as at like a policy level?
I can say one thing. This is all happening because of the unwanted hysterectomies done by the unethical doctors. I can say, I can use the word unethical doctors because I know, because I practice in the rural area also. Most of the times, even the female patients that come to us, if they come to with an RMP or a very quack, they will straight away they'll come for the hysterectomy. But I was so many times I told them it's not hysterectomy is not needed because you are in language, and at the same time the person who is accompanying is her mother-in-law or mother. They are not being hysterectomized, and this daughter-in-law and daughter, the age of 22 or 23, they have been hysterectomy. This all because happening of, I think I can say once away some of the selfishness of the some other people. I can say some other people. But as Madam has told, the Surya sir and Madam and Malti have told that we are kept in one diagnosis centers in most of the places of Telangana. The name of the diagnosis centers we kept as the Telangana diagnosis centers, where we are providing the pathologists and the microbiologists, and at the same time, as Modern has told, many equipments are being provided there. With those equipments, we are doing so many things. And anyway, we'll create an awareness. And one thing is what I feel is accountability should be fixed on the doctors, because anyway we cannot control this quacks and all these things. At least the person, those who are doing the hysterectomy should be controlled. So the only thing accountability. Just now recently, I told that our cesarean rate previously it is more in Telangana, as you told also. I think it's happening as a 2018 when I'm following the statistics. Cesarean rate is more. Now you come to any government facility, our cesarean rate is only 30 to 40%. That too in total in this primary and as well as the second gravid also is only 30 to 40% cesarean rate. So much of this all happening because of our government has taken so much of initiative. And I can say, proudly say, some of the hospitals, those are directly doing they're not at all conducting any cesareans, normal deliveries. They didn't have even labor rooms also. Straight away, the patient has been coming admitted into the theater. Directly they've been shifted to theater, from a house to the theater with the help of some of the cracks and some of the I can say some other persons. And that thing we have closed it. And recently we have seized some of the hospitals, those are doing completely cesarean sections. Our people has done the audit, and I can say in the Nizamabad recently 5 hospitals have been seized just because they are doing the only cesarean section. They are not doing. The same thing should happen in other private hospitals also. As Malati Madam knows very well, in the public sector hospitals, the rate of hysterectomies are very less. I think you can ask Madam also; she can tell us, because very less cases of hysterectomies. Now, this is all happening in the private sectors only. Thus, unprofessional persons, those are running the nursing homes. That I can say. Only thing is, as Madam has told, this Kameshwar Madam has told that osteoporosis, they should give an awareness on the osteoporosis. I've seen most of the people, because we have seen our mother-in-law women. Because our mothers, they have not been undergone any cesarean, and our mothers not been undergone any hysterectomies, and whatever even the rate of cervical cancer also is very less as compared to the hysterectomy, number of hysterectomy they're doing. Just to blame on the uterus, they're doing all these practices. One is this menorrhagia, and other ones are taking advantage of cervix. Even the what Madam told us, white discharge, it's a very, very common problem. And they'll never go for any investigation, further investigations. And at the same time, I can say one word, in the private practices, any person, I have seen some of the hospitals, not here, as sir has told that in Andhra Pradesh, I have seen one of the hospital, straight away the patient will get a foldable cot to the hospital, and they get all the medicines, and they'll underwent cesarean within an hour without any investigation. Basic means whether it's needed or not, whether the scanning report is there, whether the pap smear report is there, nothing that. Just simply they will undergo the hysterectomies. That's happening. What Madam has, and they take a very good initiative. Surya sir and Madam has taken very good initiative, and we should create a public awareness. And at the same time, government also taken so much of severe steps. We will also control this. Will fix the accountability on the private practitioners. Thank you, and give me an opportunity.
Thank you so much, Dr. Reddy. Dr. Malti, I want to come and ask you about the same thing. Like if you talk about the capacity building and the awareness creation amongst the women as well as the medical professionals. So, what are the steps that the government can take in this regards?
Powerful media is television, right? That is one media we can use, and lot of display of IEC, especially in the railway stations, in the bus stations, where a lot of public will be there, waiting for a train, waiting for a bus, and the hospitals, lot of waiting area, because we get 350 antenatal mothers per day. Invariably, there is some kind of waiting period. And on the gynec side, we have 60 to 70 OPD per day. So everybody just can't come. They'll have to wait. That is the place where we can create. I don't think that another media is FM radio. People keep watching when they are traveling. So that is one area where we can strengthen. And of course, from the ASHA workers, everybody needs to be sensitized. And the most important thing is, I feel there should be awareness to that level where the woman should feel that, why do you want to remove my uterus? Justify why. Can you do something else? Can you give me any other choice? The demand should come from the woman. To that stage, we'll have to take her to that awareness point, because now they're asking us, why cesarean? Why not a vaginal delivery? Give me a natural birth. Don't do a cesarean unnecessarily. So that is how there is a demand coming from that end. The same demand should come from the gynec side too.
Thank you so much, Dr. Malti. Dr. Malti, you have mentioned about a very important thing about creating awareness in terms of the television, in terms of the FM radios, and the advertisement on the public spaces and the waiting rooms. And like as you also mentioned, like the women also need to get a justification about why they are getting operated. So that's like one of the things. I want to come to Mr. Saxena and talk about like how BAS is addressing this issue of women suffering with.
May I just add one point? Today, because we had a HM meeting with the health minister today, we had to do a lot of practice, exercise, what to talk about the program. But today, they had no preparation. The women who were pregnant and delivered had no preparation, no mentoring, nothing. When the minister just interacted with them, they were so clear, they were so expressive. That means we are underestimating the women. We are thinking they are not knowledgeable. They can put forward the point very, very clearly. But we need a lot of preparation. That's what I realized today. They can just bring out the point. You just have to give some time. Then definitely, if you create little awareness and give little time, they can express better than us. Thank you.
Yeah, Riddhi. So Yeah, I completely agree to what points have been made. I guess as one of the stakeholders, we do realize that as a pharma company, we can't do everything. Yeah. So working with like-minded partners who understand what is needed to be done is the whole essence of it. I'll give you some examples in the past what has helped to build that community. And we always feel, as pharma company, when we do research, and we invest almost 20% of our revenues in back to research in unmet need. We always feel, if we are able to reach out and give credible information to the patients, patients feels empowered. And the point just now Dr. Malti was mentioning that they are smart, they know then how to communicate and convince others as well. Yeah. The issue or let's say the challenge in India is how do we reach out to them and give them credible information, then they can decide what is good or bad for them. I think giving them a choice is we in the past in the family planning space we had set up chatbot, we had family planning clinics, partnerships with associations like FPAI. Globally, we are working closely with UNFPA, and to an extent, we are looking at how do we provide 100 million women globally uh, from countries which are middle income countries, essentially countries like India, to have modern management of contraception. In the same spectrum, I think with the focus on HMB, we are looking at how do we have the right usage of media, including social media. We have two robust channels in India through YouTube, Instagram, and Facebook, which is Buyer for Health, which the idea is to give credible information, give platform to clinicians, doctors who can then directly communicate what is good for a woman. Uh, and similarly, we're looking at other avenues of information, yeah, and some of it Dr. Malti also said, right? Can we partner with state governments, and that's the reason why we are looking at Telangana as one of the state where we can work closely with the state governments to also utilize those channels which normally are not so much open up for a private sector unless until you spend money. Yeah. And similarly, partnering with associations like Foxy, because it's a very large organization. It has 46,000 members in India. So, they have their own channel of communications among the association. And probably that channel could also be utilized in a manner where we are able to have bite-sized information, videos in the waiting rooms, so that the communication around giving information so that a woman becomes knowledgeable and then decides what is good for her. I mean, we call it loosely as empowering women in India. How do we empower women so that she understands when to go for diagnosis, where to go, what sort of a treatment is good, what sort of information tools are better for her. Yeah. And then she can decide very, very smartly as to what and where she can go. Yeah. And that's where I think we can play a small role, along with many of you, including Dr. Reddy's to Dr. Surya Kumar. I think we need partners like all of them to really come and work together with the intention that, over time, and we can reduce hysterectomies and only genuine required hysterectomies are being done. Yeah.
Thank you so much, Dr. Mrs. Saxena. I want to come to Dr. Kameshwari. Like earlier, you were talking about the various, the issues. Like, what is the negative impact of hysterectomy? We have been discussing about like what is hysterectomy and how it's been happening. So when we want to briefly understand like what are the different problems that are going to arise because of the hysterectomy.
One thing actually I want to add to Dr. Malti Garu. Malti Garu was discussing about this. So one thing is cervical cancer incidence in India, 80 per 1 lakh. But hysterectomy is happening in Andhra and Telangana, 20%. You can imagine how wrongly you are doing hysterectomy. That's one thing I want to add that. Second point is, most of rural women after hysterectomy, their doctor visits are increasing. Actually, at the age of 30, 35, when they completed their childbearing, they won't come to a doctor. They'll be, most of them are healthy till their menopause and they'll have some menopausal complaints. But these women, going to doctor is increasing because of back pain, low backache, because of lumbar osteoporosis, because lumbar vertebra will be affected more with osteoporosis. That's one thing. And they'll have some other discharge. And most of them, these hysterectomies are happening along with appendicectomy. Appendix also removed at the time of hysterectomy. That should not be done. Any elective surgery, intestine should not be opened, because intestine will have all bacteria. So our hygienic surgery will become unhygienic if you open a bowel. So appendix is only removed during an emergency, not an elective one. But in rural Andhra and Telangana, hysterectomy along with both the tubes, both the ovaries and the appendix. It is like if you buy one and one you'll get free like thing. So they show all of them in a tray and do things. So once in a elective surgery, appendix is removed, her abdomen is also infected. Now she'll have infection after surgery. So pelvic infection is happening. That is second. And some are in our recent study between 2016 to 2020 in Yadadri, Nalgonda, Chittoor, and we did in 4-5 districts. We identified 500 hysterectomized women. All are under 30. All are under 30 years. They had hysterectomy. Out of 500, 16 had hysterectomy before 20 years. 3 of them had rupture uterus because they had a female feticide before and they had uterine rupture in subsequent pregnancy. So we have to see this in the context of female feticide also. So female feticide is also rampant in Andhra and Telangana and these districts. So we have to see female feticide and also all this context. So second, so one of our case had uterine rupture and that endometrium got attached to bladder. Now she is having every month period bleeding through urinary bladder. Severe pain, she lost her uterus, only have one child. So these are the serious issues. So that is the other serious implications of surgery. Long-term implications are different because our research is only evolving. So role of estrogen on brain, role of estrogen on bone, role of estrogen on heart and blood vessels is only evolving these days. So rates of dementia, Alzheimer's diseases, bone loss, these are serious issues. If you supplement estrogen, again a problem as a medication. If you have ovary and estrogen secretion, that is a different thing. Okay, so these are the issues, serious issues we have.
Thank you so much, Dr. Kameshwari. I would also like to add in that part, like as you mentioned about the various problems arising from that. There is another like aspect towards that it can also in a younger woman, if there's a hysterectomy, it can also lead to stress and leading to mental health and well-being of the patient. So I would like to ask to Dr. Surya Prakash on this, that what is the role of a counseling play here in such scenarios and in creating awareness and also to enable the women to make a better choice for themselves?
I mean, all through this dialogue, I'm only looking at the social component. The challenges Indian women facing is now different from what was there 10 years back. So now the situation is much different. Basically, the rates of divorces are increasing. The issues of family as a unit, it is changing. And so from my side, what I'm really keen right now is first, when it comes to the follow-up of women who's already hysterectomized, I think the onus is now falling under the communities, not even the medical sector or anyone. I'm talking about because what was a simple thing, it has become complex. Like now we need multiple experts for handling women whose organs are being removed. So we don't have, India is not yet developed to that extent. We have such trained manpower. It takes a lot of time. So what your team has proposed or working on building awareness, and as Sir has said, J.R.M. Radigar Chipnettu, like what he said about enhancing the awareness and doing it on a what do you call as a uh, as a mission mode. That's more important. And the second thing is non-interference. Basically, our work, women's work, should not be interfered with any political thing. It should be away from political thought processes. It has to happen on a day-to-day. This is very important. Where I feel because our Malti Garu is there and Reddy Garu, we meet ministers. Can we take responsibility to say, let this woman be free from any elections and or in the manifestos? Let them have access to basics and let this run from government to government. And so this is one thing which I'm looking at. So for me, frankly with you, what I imagined about our country and what is it at the ground level, it's quite different. I mean, the challenges are young, and so there is a lot of intervention should happen in what should be aired and what should not be aired. And now the media, the fear is what is being pushed in very systematically. So we need to look at that. Let's just forget about Manoj is representing where, or you're representing or something, or she representing government, I representing NGO. As human beings, a lot of damage is being done to women. Let's accept that first. Two, what we need to do is the damage that has occurred, nobody can do anything. The ifing doesn't help. So we need to develop support systems to women at the field level on day-to-day basis. And the third that we need to do consciously is relook at the primary health service delivery, where quality of care, as Sir said, yes, in Telangana there is change in quality of care because of the government intervention that is happening. And but the private players, they are still having a say. So we need to understand this, and we need to consciously look at even the private players. We can't negate their presence. We have to talk to them. We need to have a long dialogue with them, and then look at the intention. The intention, if it is for money, we need to have a dialogue different. Intention is for a service, for the welfare, the dialogue should be different. So, and people like us, we are, yes, the spirit is high, but definitely we are aging. I mean, suddenly, when I'm talking to you, I see I'm 38 years I've spent like this, and all uncertainties, no salary coming end of the day, nothing like that. We were just working for a cause and for the country, and so fortunate that you people have heard about this case. Fortunate that you people are taking as a priority. At least, Reddy Garu, let's take it a point that henceforth there's no unindicated cases happen in state of Telangana. A statement along with Malati and along with Reddy Garu, Malti Garu, Virandaru Oksari from our Foxy will ensure like a statement cheyali manam. From our department will make sure the cases of hysterectomies are not happening, at least because you said 46,000 people, if they take a pledge and they talk about it, and let them say that. And it's important. And ఇది చేయపోయినా చేయట్లేదని చెప్పడం కూడా important. Even if you're not doing it, to say that I'm not doing it అనేది కూడా చాలా important.
Yes.
We are not looking at yesterday. I'm talking about today.
Yes. Thank you so much, Dr. Suryaprakash. I want to just add, go to Mr. Manoj here. We were talking about the mental health and counseling also. Sir was also said it is important that we give support to the women. We talk about this. So how do you think a counseling services for the women and regarding the reproductive health as well as the menstrual health and the hygiene? How can we ensure these requirements?
Yeah. I mean, I think that it starts from a firm commitment that we all are committed to the cause, right? I mean, if we decide this is being needed, I'll give you an example. During COVID time, we realized while doctors have access to mental health or experts in that, the paramedical staff and nurses who were doing round the clock work did not have, So we opened up a mental health helpline during COVID time, free of cost for all the paramedics across India. Yeah. So I am sure as we work towards this in HMB as well, and we realize that we need to have certain helplines, certain tools to manage the mental health aspect of it, but also other aspects of it, yeah, from a knowledge sharing, but also support, yeah, essentially providing a support system for people who are committed to this cause. We at Bayer are more than willing to support this cause, because I think the idea is not that to, when you look at Mirena, for example, which is the drug which which is the device which you manage, actually it's under price control in India. So we are not looking from a profit perspective. What we are looking at it, how, unnecessary hysterectomies could be reduced. Yeah. And the number of 1 crore is actually, eye-popping for anyone. Any Indian will not feel good about it, right? So can we, for the future, give required support, collaborate with the right people, so that whatever needs to be done and whatever support is needed to be done, including helplines, including chatbots, including digital media, including social media, we are more than willing to work closely with them, so that where the information needs to be done and whatever support is needed to be given to the caregivers, whether it's ASHA workers or paramedicals, we are more than happy to work with that.
Thank you so much, Mr. Saxena. I would like to come to Dr. Reddy and both Dr. Malti about this. How can a policy intervention help in overcoming this issue? And it's a very important thing. Dr. Reddy first.
Yes, sorry.
So doctor, how can we come up with a policy, we can include a policy here and to overcome this issue of the hysterectomy operation and reduce it?
You can say
in India?
Yeah, one is as Malati Management told, that's IEC, Information, Education and Communication, that is to do it, and public awareness, and we will take anyway ASHA workers at the one community, this is the one department, we are having the ASHA workers. So the role of ASHA workers in right now, we are taking their help in controlling these cesarean sections. At the same time, as you told, we'll take the help of ASHA workers and we'll create a public awareness, and among the women also, because all the ASHA workers are the women people only. So they'll take an awareness and take an advantage to create an awareness among the women people, so that this will be, the confusion state of the women will be somewhat, because most of the doctors taking undue advantage of the issue. And at the same time, what I told, I insist on the same thing. Already the government is in the process of going for the accountability, fixing the accountability. That also government, I hope the government is taking all the steps. And as Madam has told that regarding this, pap smear and other things, our government already taken so much of initiation. And for the past 3 years, so much of growth, medical growth in the public sector is happening, and that's all we can say. Better is the public awareness through the ASHA workers.
Yes, thank you so much, Dr. Reddy. Dr. Malti, I want to start with you. Let's close down this entire session. How we were discussing about the various aspects about hysterectomy, how is this affecting, and the number of cases we have seen over the years in Telangana, where we hope that we create a change there. For the closing remarks, I would like to start with you, Dr. Malti. What can be done, and what are the initiatives we can take as a gynecologist, as a medical health expert? What would you suggest?
Number one, the point which is agreed by all of us is awareness. How to create, we have discussed. First is awareness. Second is demand from the public. Demand from the end user, that is the woman, because it's the quality of life which is getting affected. So it is her quality of life which is getting affected. As Madam rightly said, Kameshwari Madam, she said, they should know what are the side effects of early menopause. The quality of life is gone. There is a dyspareunia, even her sexual health, the mental health, everything is destroyed. So the quality of life, so that's why there should be a demand from the public, that is from the woman. She has a right, autonomy on her body. We cannot just remove any organ from anybody. So the dignity of life has to be maintained. So awareness, the demand from the woman. The third point, the last point, as Sir rightly said, Jayaprakash Reddy Sir said, the accountability, the way we are writing the indication for a cesarean section, it should be a justified indication. So accountability, maybe awareness, the demand, the accountability would be sufficient to start with the beginning steps.
Thank you so much, Dr. Malti. I would like to go to Dr. Surya Prakash and Dr. Kameshwari together on this.
Yeah, but as I said, this meeting has given us an hope, saying that people are going to go but the time bound. When is the question? When is the question that we need to talk? Now is what we look at. We look at eternal now. And the third is the ASHA workers or the workers that we talk about, they're already bombarded with so much of work at hand. And so it is necessary, we need to look at how much work they're already handling, so that the additional ones, what it would do. So the second thing that I was looking at. The third is, let's respect women and give them space to practice their own cultural aspects that would actually bring them together and have a dialogue with them, and then they can decide. So I feel these are the three things that are coming to me. So thank you so much for giving us an opportunity to talk about this.
Thank you. Thank you so much, Dr. Surya.
We have two campaign materials actually. I wrote a note on his uterus talking to young girl. How much help I'll do in your long-term health. I'm like your lifelong friend. So like that, I wrote a note in Telugu, 3-4 pages note, and also a book, How to Save Uterus.
That will give you.
We'll give you that material in Telugu. You can translate into Telugu. It is in Telugu. You can translate into English. So we are doing two campaigns. Actually, they are doing very good. One is Let It Flow. That flow should not be stopped, because women who have 40 years of uninterrupted menstrual cycle will have a healthy old age. That is a research saying now. Okay. So 40 years of menses, we should not be intervened in between. Like girl have menarche at 11, she should have menses till 51. That's the thing. So unless otherwise proven cancer, grade 4 prolapse, very big fibroid, only intervene. Otherwise, protect uterus till he reaches the natural menopause. Because natural menopausal ovaries will help her for another 10 years. So she'll have protection till 65. If she protects her uterus and ovaries. That's the thing. So if you want a healthy old age, you take care of these things. That should be our campaign. Okay. So these are the things. Okay.
Thank you so much, Dr. Kameshwari. I would like to also come to first Dr. Reddy first, and then we will go with Mr. Manoj. Dr. Reddy, your closing remarks.
Yes, my demand is always the same way. As we told, that's because being in a Telanganite and I'm in the government public service, whatever the facilities we can go for the women, because they are the main pillars of our society, and without them the family cannot run. And at the same time we should give respect to them, because also previous also we have taken the initiation of KCR kit, what you told, a respectable mother. If any patient, any pregnant lady comes to us, we'll treat her in a respectable way. The same way we'll give importance to the females, women, and we'll see that awareness will be created among the women people through the ASHA workers and ANMs and some of the staff nurses. And as Madam told, that IEC material also will use. And finally is the one thing, because the public sectors will try to do it, but the person, those are purposefully they are doing this hysterectomies unwantedly, so without following the ethics. So for them, The accountability is only the way. There are no other way except the accountability, fixing the accountability and going for the audit. So that I think our government has already taken initiation. It will also be implemented in short time. Thank you and thank you very much for giving me an opportunity.
Yes, thank you so much, Dr. Reddy. Mr. Manoj, I would like to come and end with you about the entire thing about the initiative, talking about the BEARS initiative, and also a very important aspect we might have not spoken, like the behavioral change in the society. On this, it can be a closing remark to us.
Yeah, I see we are already half an hour
Yes.
more in the slotted time. So it also speaks, that all the panelists are so passionate about this topic and want to contribute something. Yeah. So we are happy to have this initiative, Preserve the Uterus. So what we are trying to look at is, one is work closely with various stakeholders, including Telangana government, to see what can be done, essentially to have capacity building, awareness, tools, technology, platform, so that at the end of the day, the women in Telangana has choices, feels empowered, so that she doesn't get unnecessary hysterectomy being done. And I think in that spectrum, our role is only as knowledge partners. Yeah, with over decades of research and decades of understanding on the medical side of things, with our research in pharmaceutical and also on LNG, we are essentially looking at how do we partner with only the vision is to that every single woman who doesn't need hysterectomy could be avoided and could be informed well. And so my outlook is working closely with both public sector, government of Telangana, but also private sector in capacity building, awareness, so that at the end of the day, we all can, be happy that we have contributed in some positive manner, yeah, rather than just be living in a status quo. Yeah. And that's what is our commitment to this project with our strategic partners.
Yes, thank you so much, Mr. Manoj. And I would like to thank all the panelists here who have joined us today evening, talking about a very important issue. And we hope that we all together create this awareness, and we ensure that all the women are aware about their bodies, and they also, as earlier it was mentioned by Dr. Malti also, there should be an awareness. They should also demand for the women should also demand what is happening with them, and as Dr. Reddy said, there should be an accountability of the things what is happening, and entirely everybody together can do this, and the women have a better choice for themselves. That should be initiated. And thank you so much, everybody, for joining us today and talking on this very extremely important topic today. And I would like to thank on behalf of the IHW Council, I wish to thank all the panelists here, and especially to Mr. Manoj, who has been here and been supporting us for this entire campaign and talking about this, creating an awareness entire India. Thank you so much again.
Thank you, everyone. Thanks a lot. Thank you. And we'll reach out to all of you, Dr. Reddy, Dr. Malti, and Dr. Surya Prakash. We'll reach out to you when I have our colleague Deepak Chopra also on this call, and individually we'll reach out to you so that, in this spirit of partnership, what support we can provide. Yeah. Thank you so much once again.
Sure, sir. Thank you.
Thank you.
Thank you, sir. Thank you.